Welcome to our talk on glucose control. This is such an important topic for so many of our patients, and we're really excited to share some of the latest information. I'm Dr. Molly Force from Prosper Natural Health here in Port Townsend, Washington, and I'm joined by Dr. Rosalie de Lambert, who is our co-team physician here. We are naturopathic physicians who really specialize in functional medicine, looking at the physiologic reasons for imbalance that's going on with our patients. And because blood sugar is so critical for so many different systems in the body, as you're going to find out today, it is absolutely critical that we look at what's going on with our patients in regards to their glucose. We have lots of these doc talks that we've done and are available for you on our website at prospernaturalhealth.com. Come and check them out if you're interested in learning more about natural medicine and ways that you can help balance your health.
So we've got to start with an introduction here. Why do we need carbohydrates in general? Well, there's two main types of carbohydrates. There's your indigestible fibers and your digestible fibers. These are digestible forms are the simplex and complex carbs that we talk about. Your simple carbs are kind of your table sugars or your fructose, which comes from fruit. And these ones are digested by your own cells. The indigestible ones are digested by your microbiome. So carbs are food for the cells. Glucose is one of the simple carbs. It's your muscle's favorite fuel. And carbs are also food for the mind because glucose is the brain's favorite fuel. Yes, the body can use different fuels like ketones to work, but this is kind of the preferred mode for the body to exist in. So we've got to think also of how blood sugar is regulated. When you intake anything with carbohydrates, the pancreas is one of the first hormones involved. It secretes insulin, and you've probably heard of insulin. It is the type of hormone that takes sugar from the blood and stores it away. So it's super important here. We'll talk about it a couple times through the slide set. And you've got to remember that insulin is the one that pulls sugar out of the blood. A couple of other hormones are involved, including glucagon, which is made also by the pancreas, which kind of brings sugar into the blood from its storage form.
What we find is there's a complex network of these hormones that are communicating every moment to keep your blood sugar balanced. And why this is so important is because, of course, we need regulation of sugar to go to our brain so that we can be functioning. So there are some major hormones here that are at play, and they help us with the signaling of, are you hungry? Are you not hungry? Do we need to seek out glucose and sugar or not? So some of the main ones we want you guys to just understand are this complex communication between the brain and these different organ systems with hormones like ghrelin, which is, we consider it the appetite stimulator, and leptin, which is an appetite suppressant. Now, there's an entire complex of hormones that are being communicated through, for example, with the hunger. So the stomach is releasing this ghrelin, which communicates to the brain, and that helps us know we need to eat, and so we go and seek food. Now, after we're done eating, we get this like expansion that happens, and we can have some secretin that's released to tell the pancreas, here comes the sugars, get ready, and that will help with the communication that goes to the liver, which is so important in processing our sugars and our proteins. Now, we also have this communication of, hey, we're feeling full, coming from the fat cells themselves, the adipose cells, and that communicates to the brain. And also, we have a very important interaction with insulin, which is going to help sequester, which means bring in the sugar out of the circulation, out of our blood vessels, and that's going to help with the energy storage, which goes into muscle and fat both. So, and helps with the brain as well. So we wanted you guys to understand this idea of leptin. Now, this is secreted by these fat cells, this adipokinase. And what it does is it decreases with levels of fasting. So if you're fasting, your leptin goes up. And then after the food intake is there, or if we have a lot of fat cells, then we have an increase of leptin. And leptin is going to really suppress food intake and promote this energy expenditure. So that's an important thing to know. And then also, when we think about adiponectin, these are two different things that we can test in blood work. It is something that's decreased whenever we have more fat cells with obesity. And then the levels actually increase with weight loss as those fat cells are being burned. So this is really important for understanding how our body regulates fat storage and how ultimately it regulates blood glucose.
So again, here we talk about insulin, but in this case, it's insulin resistance, which is quite common, honestly, in the Western world. In that when your body pumps out insulin all the time, remember, insulin is in response to eating carbohydrates, the body cells start to see it a little too much and stop responding to it quite so quickly. So they start to show a resistance to it. In this society where we're constantly fed with carbohydrates, the standard American diet, we are basically setting the body up for a level of insulin resistance. Sugar no longer is able to exit the bloodstream and enter into the cells. The insulin is there, but the cells are not responsive to it quite as well. This leads us to a blood sugar roller coaster potential. If you have a high sugar, high carb meal, of course, the blood sugar increases. The pancreas sees that, it secretes the insulin, which should lower the blood sugar. The adrenal glands are also responsive here. They release epinephrine, which also can increase blood sugar. And the adrenals can get exhausted by repeated stress, including cortisol, which we'll talk about later. They stop their response, and you might have something called a reactive hypoglycemia. So there's a roller coaster here. Hypoglycemia meaning low blood sugar. You add more sugar to the diet again, and the cells start to become less and less responsive, leading to prediabetes and diabetes type 2. So hemoglobin A1C is the marker we see in the labs that tell us about your 3-month status of blood sugar levels. The range should be, the range should be below 5.7%, and once you are in the range of 5.7 to 6.4, we label that as pre-diabetes. Another way to find this, to make this diagnosis, is to notice the fasting blood sugar over an 8 to 10 hour fast is elevated over 100. This is a really excellent time to have a check-in with your provider and yourself about, okay, how do I prevent this insulin resistance from turning into diabetes type 2? So with diabetes, there's several types. Of course, type 2 being the most common. That's the one we're sort of focusing on today. It's a chronic disorder of carbohydrate, fat, protein metabolism. We diagnose it in a couple of ways. It's the next step up from prediabetes. It's where your fasting blood glucose is over 140. Or you take an oral glucose tolerance test where you take some level of glucose in, 2 hours later, your blood level's still elevated. And this is where your 3-month marker A1C is above 6.5%. So commonly, this is paired with symptoms, whether it's increased urination because the body's trying to get rid of the excess sugar, increased hunger because the body's trying to deal with the excess carbs, and especially excessive thirst. When you have too much blood sugar all the time, we start to see what's called microvascular damage. Sugar is inflammatory to the inflammatory lining of the cells of the circulatory system. So the organ systems that require a lot of blood see the most amount of inflammation first. So we think about the eyes, vision loss. We think about the kidneys. Their whole goal is to filter the blood. We start to see kidney damage. Also, skin ulcers are quite common in diabetic folks.
So we really don't want those negative inflammatory reactions happening for our patients. So we often are asking them to get blood work, and often annually we are asking them to check their hemoglobin A1Cs and to even just do a standard fasting glucose on their comprehensive metabolic panel. So we offer several different packages currently at our clinic for different testing options. A simple basic annual panel is very comprehensive. It includes both of those things I just mentioned. If we're looking more for somebody who's dealing with metabolic issues and having issues with their weight, then we're testing the weight support panel, which really looks at the adiponectin and the insulin and the leptin, which are going to be some of those signaling hormones. And then if we're more concerned about damage that's inflammatory because of these metabolic imbalances or metabolic syndrome, we're often looking at more of our comprehensive heart profile, which really breaks down those lipids in a way that tells us about some of the inflammation that can be paired with the blood sugar imbalance and cause damage to the vascular system. So when we're measuring blood sugars, of course, a single fasting glucose is like 1 point on the chart. It's nice to know where a patient is, especially in the morning after they've fasted, because that kind of tells us a little bit about what's going on with their insulin control. But that is a very small little window. As Dr. Rosalie said, the hemoglobin A1C is considered our most accurate because it's looking at an average of what the blood glucose has been over the last 120 days because it's tracking the red blood cell cycle with that. We also occasionally will just take a random glucose sampling to see what's going on. And we have to take into consideration whether our patient is fasting or if they've had food and what type of food they've had, if that's the case. And then one of the most powerful tools that's now become available to our patients who are non-diabetic are CMGs, the continuous glucose monitors, which are typically inserted. And we're going to talk about that in a second. Now, we do sometimes use glucose tolerance testing, which is where we give a certain amount of glucose. We call it a bolus of glucose, a little syrup, and we test how much exactly of this glucose we've given, and over a period of time, how much that makes the blood sugar spike. And that gives us an idea of if they're dealing with insulin resistance. Now, as far as glucose related markers, we're often testing things like the insulin, the C-peptide, and sometimes there is this insulin tolerance test, which I was just talking about, where we're looking at that in combination with the glucose. So in regards to testing, there's another set that can be really helpful that Dr. Rosalie is going to cover here.
So, we talked through blood testing, and this is an important salivary test here, these next two slides on cortisol testing and hormone testing. So, cortisol is your stress hormone. It gets secreted when there's something physically or emotionally stressful. What cortisol does is it keeps sugar in the blood, in the bloodstream, so that your muscles can use it and your brain can use it. And it keeps glucose in the bloodstream so that ultimately, if you're stressed, you can run away or do some deep thinking about what's the next step. So what the salivary test does here is it checks over 6 data points in the day. What is the diurnal rhythm of cortisol? And the first 3 samples are within 60 minutes of waking to get that nice cortisol surge response. We do one at noon, one at evening, and one before bed, and it should sort of follow this spike and then diminishment that we see. Cortisol is important in blood sugar regulation because if there's too much, then we're thinking about too much sugar in the blood. The female and male hormone testing, just in general, the sex hormones are also really important in glucose management. Estrogen can increase insulin sensitivity, as can testosterone, which means that, okay, the cells are more reactive to insulin. They're better responsive to this hormone. They're better able to pull the sugar out of the bloodstream. Progesterone, curiously enough, decreases insulin sensitivity. So if you've ever been pregnant before, you probably have felt felt these effects, and which is also part of the reason why we see gestational diabetes. So we can do a salivary test first thing in the morning that checks for all of these hormones, including other key ones such as DHEA, cortisol, sex hormone binding globulin, as a way to get a sense for what are the ratios between these sex hormones. Are we in an insulin resistance pattern with the sex hormones, or are things looking nice and balanced?
When we are thinking about tracking glucose, like I mentioned earlier, this has really changed for our abilities over the last few years. It used to be that we'd always be sending home these glucose monitor prescriptions for our patients, asking them to do finger pricks and checking their first morning fasting glucose, and then again 2 hours after they've had a meal, and then sometimes even before bed. Now, this is something that it can be really tedious. It requires a lot of equipment. Now there's this availability of these continuous glucose monitors. Now, what they do is you can see this little example here on the right-hand side. It's a little tiny patch that goes on typically right underneath our arms, and it just plugs in. Kind of feels like a rubber band slapping your skin as it goes in. And then it has a little tiny capillary that helps provide the information to the monitor, and then that monitor sends via Bluetooth information to your mobile device. Now, what's so cool about this is we can track every 10 to 15 minutes what is happening with glucose, and you can really see how you react to certain foods. Now, this has been very powerful because not every patient reacts the same way to different starches. So we've known for a long time that high glycemic index foods, so foods that really spike blood sugar typically because of the way those fuels are used and broken down by the intestines, are things like our white starches. We include our rices and our flours and our potatoes in that. But some patients tend to do well with certain forms of those, but not others. So it's really great information to know, hey, I tolerate potatoes more than I do noodles, for example, or I can do some bread, but I can't, if it's whole grain, but I can't seem to do, like oatmeal in the morning. So these are just different examples that are so helpful for the patient to know. Also, it can really help the patient in starting to pair different foods and seeing the importance of bringing fats and proteins in with their high carbohydrate meals. And there's so much data that can also be gained for patients in regards to their stress levels. They may have the same meal 3 times in a row and notice, wow, my cortisol is spiking with a certain either trigger person or trigger environment, and I need to be really careful of that because it's causing this blood sugar roller coaster. Another interesting thing is watching patients' blood sugar just dip down very low, and they get tired or irritable, and they start searching for certain foods like, oh, I always have a craving for a cookie at 3 p.m., for example, or I need my chocolate come 4 p.m. Whatever that is, it can be really helpful for the patient to identify.
So there's multiple options for glucose management that we'll walk through here quickly. So this is kind of a organizational slide that talks through, where do we start when we see prediabetes or diabetes type 2 early stages? Where do we start? Of course, the first piece is dietary changes. How do we diminish the carb intake, increase the fat and protein intake so that there's not so much carbohydrates that the body and the insulin has to manage? Another piece here is exercise optimization. There is a therapy known as a postprandial walk, a 10-minute brisk walk after meals that helps pump out more insulin. So it's like, where does your exercise fit into your day? Also is super helpful for the pre-diabetic and the diabetic type 2. Inflammation management, also a big piece here. Of course, we're thinking about how do we mitigate that microvascular damage from all the excess blood sugar. A huge range of botanical medicine and herbs are available, which we will walk through in the next few slides, as well as nutraceuticals, vitamins and minerals that can help with hormone balancing, stress management, sex hormone balancing, of course, the thyroid hormones. And then, of course, are many classes of pharmaceuticals in this regard, which will be introduced on the next slide. So here's just, a whole bunch of data. This is kind of a complex slide here, but it tells you all of the possible pharmaceuticals that are out there, from the metformin to the GLP-1 analogs. We will sort of focus on one in particular, which has kind of gained more of a reputation in the last few months.
The GLP-1 agonists have kind of revolutionized blood sugar control, and they are really hot on the market right now. Most of you may know this by Ozempic, for example, which is semaglutide, but there are multiple on the market. And, we've been using these with our diabetic patients for almost 10 years now. Somewhere in there, maybe more like 7, but it's been pretty amazing watching this be a transformative option for some of our diabetics. It's now being used quite a bit for other reasons, maybe prediabetes or even just blood sugar management or even weight control. And these are kind of off-label uses for some of these meds, although some do have FDA approval for weight management. One of the things that this does is it slows the emptying of the stomach. And so there's a satiation feeling where you feel full. We also know it does shift the microbiome, which is very curious as well. That can really impact some of these cravings for people as well as their blood sugar control. And then the way they really work is by stimulating the body's own insulin secretion. So very powerful medications. We do compound these for some of our patients or have them get them straight through their insurance if it's well covered. Really depends on what's going on for the patient, but they can be powerful tools. So we wanted to make sure to mention them. We're going to be talking about some of the natural resources, though, because with all these pharmaceuticals, they all do have certain side effects that we always have to go over with our patients. And we want to make sure you guys know about some of the cool things that are coming out in the natural world.
So here's some research just from 2024 here on the plant-based diet as a treatment for and management for diabetes. And what's sort of the overarching theme here is that, of course, you add more fiber-rich foods, usually from the veggie world, you're getting less of a glycemic spike, and that it supports multiple pathways in diabetes management here.
We wanted to make sure we touched on the ketogenic diet. We have an entire slideshow all about this, a whole presentation about it. So make sure you check it out if you're interested. This can be a very powerful diet. Now, remember, this is one that is incredibly low in carbohydrates and very high in fat. Fat is the main lead for this. And what we found with looking at our patient CMG monitors over these last few years is that fat seems to be the great regulator. It really does help people with keeping that blood sugar really in that nice narrow window between 80 and 140. It keeps them in that safe zone and keeps them feeling more stable mentally a lot of times too. So the ketogenic diet can be really a powerful one. And what they saw in this study is that it had a significant reduction on the body's requirements for insulin because the body doesn't need to sequester the blood sugars as much because they're not spiking, and much less need for these oral anti-diabetic drugs, of course, in these diabetic patients. And this was specifically, they're talking about type 1 diabetics who require insulin. It's pretty powerful.
Fenugreek here is an excellent Ayurvedic herb, and I love this study so much because it's a systematic review and meta-analysis, which means they've looked at a whole bunch of the studies in the primary literature and kind of taken all of that information together. So fenugreek has been seen to, number one, show a clinically, statistically significant reduction in fasting blood sugars, in postprandial blood sugar, so after meal glucose, and in your A1C, that 3-month marker of blood sugar levels. So such a powerful herb, a really powerful study that describes its effect.
Many of you may have heard of berberines. Berberines are often gathered from Oregon grape or golden seal. These are such available and powerful glucose regulators. And what this study was showing is that there's multiple mechanisms in which this works to help with blood sugar management. And so that can be really powerful for our patients that might have resistance for multiple different reasons. And so this ends up being a really great herb that we're often pairing with our patients' meals to help them with that blood sugar regulation.
Another Ayurvedic herb here, bitter melon, which has been seen. This study describes its multiple constituents, which are charantin and lysine, and it tried to understand, okay, which of these constituents are best for blood sugar lowering. And indeed, all parts of the fruit, both of those constituents have an insulin-like activity, which means it helps ultimately increase your insulin so your cells are better responsive to it. And additionally, it's super helpful and anti-inflammatory. So any of the inflammation piece gets also managed by this excellent herb.
Many of you have probably heard about how cinnamon has been very touted to help with glucose levels and blood sugar management. And this is a great study that was pretty darn recent that's showing that there are significantly greater reductions in fasting blood sugar, in particular with cinnamon. So one pitfall sometimes our patients come in having fallen into is they'll be having that cinnamon on top of like oats or something that's very carbohydrate rich in the morning. So we're usually talking about ways to incorporate cinnamon in other parts of their meals that aren't so carbohydrate rich. But this can be excellent as far as helping with management of this fasting glucose. And this is just so cool that there's just more and more studies coming out about these simple kitchen remedies.
Another Ayurvedic herb here known as gymnema. This was, again, a meta-analysis, so a combination of all the studies they could find back in 2022 on this particular herb, this one, and bitter melon, Momordica charantia. So seeing both of those together, again, it confirms that, okay, it supports the increased insulin activity, thus making these hypoglycemic herbs, helping diminish blood sugar. I use this one also very successfully in practice for sugar cravings because in Sanskrit, gymnema means killer of sweet. So you're able to take the tincture and it dulls the sweet taste buds for a period of time so that, especially with binge eating disorder, things end up tasting very different.
In regards to minerals, we think of chromium as being one of the most powerful in regards to glucose management and blood sugar management. This is a more recent study that's talking specifically about how effective it can be in regards to managing these hemoglobin A1C levels. This is pretty significant because a lot of these people in this study had very high hemoglobin A1Cs. We're talking about 10, above 10, which is significant diabetes levels. And they had a decrease down to like 7.2 plus or minus 1.7. So very clinically significant difference just from this addition of receiving chromium. And so this is often a really powerful, inexpensive mineral we are talking about with our patients and initiating for control of diabetes and other pre-diabetic factors. So we want to invite you guys, if you're looking for a clean source for different supplementation, it can be very wild out there in regards to being able to trust your the supplier and the ability of getting very clean products. So we have physician grade products only that we've curated here within our apothecary. We have an online store you can check out through our website with 3 different portals there. And we also have an in-person store here in Port Townsend. So we always like to just mention some of the products that we are using with our patients, but remember this is very individualized. It really needs to come from your practitioner. We're happy to help you with this if you are looking for support and recommendations here. So As far as single herbs, some of the most common ones that we are gravitating towards are those berberines. There's a product called Berbivale that's been put out by Designs for Health that we really love. We're often choosing that for our patients. Sometimes we're having our patients use that Gymnema as a reduction for their sweet craving. So once again, if they know like 3 p.m., that cookie craving time, then that's when we're saying like, hey, use this beforehand. You're not going to have that taste sensation that's satisfying, so you won't be going back for more. And that can be really helpful for changing and breaking cycles, which once again, when paired with that continuous glucose monitor, it can be just a game changer for patients. And then the other thing that we're also sometimes using are combination supports that might include chromium as well as several of these herbs like bitter melon and the berberines. And that's one like the Mountain Peaks glycemic formula. We also sometimes will be using chromium alone. And then, of course, we're wanting to look at figuring out where the imbalance is coming from. So we're also trying to look at what's going on with hormones and what's going on with inflammation, what's going on with stress management. Are we getting enough exercise and food? So this is just a start.
So that concludes our doc talk today. Our next doc talk will come in fall. We're taking a summer break from June to August, and stay tuned for that next talk.
And we're looking forward to seeing you guys. If you have questions, please reach out to our office. You can check out our website and find out more about what we offer, look at other doc talks, get to know us a little bit through those. And we are available both on telemedicine as well as in person to help you feel better and to figure out what is going on with your health and rebalance. We love doing this and we look forward to working with you.